Welcome to the HealthChangers podcast, presented by Cambia Health Solutions, where we share real stories of healthcare transformation from those experiencing it and those helping to make healthcare more personalized. For the past 15 years, Cambia Health Foundation has been working to transform the healthcare journey by connecting change makers to the resources and knowledge they need to maximize their impact. Since 2007, the foundation has funded over $110 million in grants to advance whole-person healthcare models at every stage of life to build a just and inclusive healthcare system for all. Today on HealthChangers, our guests are Peggy Maguire, president of the Cambia Health Foundation, and Paula Jones, who recently retired after serving 12 years on the board of directors for Cambia Health Solutions. Paula was instrumental in the formation and strategic direction of Cambia Health Foundation, which recently created a new endowed scholarship named in her honor.
Welcome, Paula. It's so great to have you here. Thank you for your time. I cannot believe the foundation is celebrating our 15th anniversary this year. And of course, you remember how it all began. You were a very big part of it. So let's start out by having you tell us a little bit about how you came to work with Cambia and what interested you in the work.
When I arrived at Cambia, it was known as Regents. And I had received a phone call from a dear colleague and friend that I had worked professionally with over the years. And he said that Regents was beginning to take a look at their community outreach work, that they had a very strong business cause, that they were encouraging not only their clients and their customers and their providers to begin to think about healthcare in a different way, but they also wanted to do some things in the community that would indicate that they were moving forward into some areas that perhaps had not been looked at. And so I submitted a proposal along with a number of other consultants. And fortunately, I was selected. So I came into Regents, and it was such a blessing because Regents, in my opinion, has always been very open and very transparent. And I was invited to visit every market, every leadership group, community leaders, employees, and to talk to people about what Regents stood for. And so that was the foundation, that was the beginning. And from there, we moved into what type of, I want to say, signature community outreach might we get involved in.
That's great. Well, it was lucky for us that you were engaged and that you submitted the bid, because I think, with your creativity and intelligence and passion, you really helped the foundation board get to a great place, and work that I'm very proud of and proud to have carried on. But why don't you tell us a little bit about how the board came to find its signature program at the time?
It was almost mind-changing for me. I had come out of running very, very large corporate foundations and very large community outreach programs all over the world. And for a healthcare company, an insurance company, to step into an area in the 90s called palliative care, when it wasn't known as that. I don't even want to use the term that was being used at the time, Peggy, because it was such a negative term. Right. And to step in and to say, it's not about dying. It's about how do we help support people who are in chronic illness situations themselves? How do we support the families, the caregivers, those persons that are helping them to survive these difficult times? How do we do some things? How do we help the national dialogue? How do we help our medical schools to think about dying as part of living, or chronic illness as part of a health passage? And that's, even now you can tell, it made me so emotional back then, I still get chills, that we were willing to take that on. And out of that, the foundation was born. And at the time, it was the Regents Foundation. And then as Regents evolved into Cambia, it became the Cambia Health Foundation. And over time, with your leadership and with the board of directors of the foundation, it has grown in ways that I don't think any of us could have ever imagined. It is the number one signature changer in my mind. And it's written, and we've gotten awards. I say we, I'll always be we. I'm sorry. I adopted myself into the family. But that's what happened over time. And then our community local programs became more strategic, more targeted, focusing on the things that were important in those communities in ways that was helpful to us.
Well, thank you for your leadership and for your outreach to the community and for listening to the top leaders in the company and helping to shape something that has really defined us. Sometimes people ask me, what are you most proud of about the foundation in the last 15 years? And I think it's that original leadership and that bravery, the willingness to go where no one has gone before and not to shy away from something because it was controversial or unknown, that we're not to be looking for really the highlights or the headlines. We were more looking at what can we do that is consistent with the company's overall mission of, transforming healthcare and making healthcare experiences better. Where could we apply our resources to an area in healthcare where it would really make a difference in people's lives? Yes. And that was the focus. And I think I just applaud your work and the original board of directors and leadership at the time for having the bravery to move into an area that, as we all know, was the subject of political rancor yes. at the time. And yes. So good for all of us.
What really makes a difference is when companies aren't afraid, when they're willing to take risk. And Regents was, Cambia is. And I think it would be helpful to our listeners if you could then talk a little bit about the Sojourn Awards, because that became kind of the bell that you point to at the top. So maybe you could tell us a little bit about that.
When we started on our Signature Sojourns program, we first started by providing seed funding to local hospitals in our region so they could build their inpatient palliative care programs. And then we gave the original Sojourns Awards to the folks that were building those programs, to the leaders and the pioneers in the field. And what we did every year was we held a luncheon where we gave them an award. It came with a $50,000 grant. And we said, this is our investment in the good work that you are doing. And we want to shine a light on your good work so that other people become aware of what palliative care is and how it can help them. That a couple years later, we did a survey. We partnered with the National Journal to do a national survey of consumer attitudes toward palliative care. And we found out that most people didn't know what palliative care was. They'd never heard of it. But once our researchers gave them a definition of it, people said they wanted it, thought that more discussion about it would be helpful and that it should be a priority for the healthcare system. So what we also learned at that time that there wasn't a palliative care workforce. And so what we set about, we changed our original program from recognizing existing programs to then building the workforce. So we started investing in emerging palliative care leaders. And we were betting that our ability to identify, cultivate, and advance the next generation of palliative care leaders would create change in the healthcare system, would improve the immediate care of people with serious illness, but then transform our overall healthcare system to be more person-focused,
Yes.
economically sustainable, holistic, and healing.
Yes.
And I'm so, I get goosebumps when I think about these people that are in the program, because we have funded 96 scholars to date from all over the country, from, the East Coast to the West Coast, to the South, to the Midwest. We have folks from Harvard and Stanford, Yale. We have folks from community health centers.
Good.
It's really just this program. We have social workers, chaplains, physicians, nurses. We've created a community of change makers that are completely dedicated to transforming healthcare and improving the patient and family experience. And, each one of our scholars, it's a very competitive program now. We get a lot of applications. We only fund up to 12 scholars a year. So each scholar receives a 2-year, $180,000 grant to work on an innovative project for the field of palliative care, but also to work on their own development as a palliative care leader. So they get communications training, they get policy training, they work with a professional mentor. We have an advisory board of palliative care leaders who are serving as mentors to the scholars once they enter the program. And, we started this program in 2014. We said we were going to fund 10 cohorts so that we would get to 100 scholars across the country. And we are just launching our application process for the 10th cohort. By the time the program is over, we'll have funded more than 100 scholars. And I think they're just the shining lights of change across our country and in our healthcare system.
We've been together long enough that that I talk about life as a journey, and that thinking about the processes that we go through, I think it could not be more appropriate. And to honor those people and to hold them up so that they can continue to help the rest of us, because there's no one that won't be touched by one of these situations. There's just no one. And so having this, I think, is just so incredibly important. So I just wanted to make sure we shared that.
I know that, as you've said, we've known each other a long time. And I know that, I know you're incredibly strategic and passionate about the work that you do, but you're also passionate about mentoring and giving back to others and lifting people up. I see we've talked about your impact on the organization as a whole, and hence your impact on the system, but let's talk about the impact you've had in terms of mentorship and the people that you've led.
Oh, goodness. Well, first of all, you just said it a few moments ago. Life is really about relationships. It's about listening and hearing and then responding. It's about being able to get out of your own way and out of your own tunnel vision to allow space for others and for their opinions. It's about really wanting the best, not of what you think the best is, but to help someone else, to help others become the best of who they should be. And so my whole life, my formal mentoring started when I started high school. I went to a really tiny little all-girls Catholic high school in Chicago. There were only 40 young women in my class and 140 in the whole school. And my job was to mentor, coach, and tutor a Yugoslavian student. I didn't even know where Yugoslavia was. Clearly did not speak the language, but that was my first job at mentoring. And it was so wonderful because she had to teach me so that I could teach her the things that both of us were supposed to be learning. And it just started a wonderful relationship of how people, all of us have gifts. And we have gifts that we can share with one another and we can help each other. And so one of my passions has always been mentoring. And I have done it. I have volunteered. I now do executive coaching. It is my lifeblood. And what's interesting is I never thought of it that way. But in every professional role that I've held throughout my 40-year career in major corporations, I realized that the biggest impact I had was working with some incredible people where we taught each other how to move forward into becoming, and I always say, the best of yourself. And nobody knows who the best of yourself is except you. Okay, you know when you've given your best. And so I've continued to do that. I was blessed that at Cambia, I was encouraged to do that by senior leadership. So you and I created a relationship. And I always tell people, you know, to me, there's three legs to this stool. There's mentoring, there's coaching, and there's sponsorship. And don't get confused about those three different legs. And so being a mentor is a really, I want to say it's almost sacred. You have to trust each other. You have to want the best for the other person, but it's what I do. I'm also fortunate that in my personal life, my husband and I do not have any children. It just wasn't God's plan for us. So we've had the opportunity over our marriage to be able to reach out and support other young people and other people in our community by helping them to look at the world, to stand taller, to push harder. And I think everybody benefits. So I was able to do it at Cambia. I continue to do it in my personal life. And I think we all benefit.
Well, and I love what you said in your approach to mentoring. It's about finding that light inside someone and that special gift that they may not have uncovered yet.
Yes.
But that once through kind of that discernment process or conversation or tough conversations, self-awareness begins to grow and people can step more fully into who they are. And then their impact just is so much greater. And, you know, I'm speaking in the third person, but I'm talking about myself.
Well, and we all go through that, you know, and it's also about being a safe place where someone is not afraid to take risk. Risk are hard, you know, risk are hard, and we think about it and we talk about it, but life is made up of risk, you know, personal, professional. Peggy, you know, I was thinking about something. All of us in the last few years have gone through such significant change, personally, professionally, the foundation, because of COVID. And so could you kind of fast forward us into how it has impacted the work of the foundation and kind of where that might be moving as a result of some things we learned and saw and experienced?
Yeah. Thank you for that question. It certainly has impacted the work of the foundation. When the pandemic hit and we were all immediately sent to work from home, and really our team was focused then on meeting the most urgent needs in our community. We went from our traditional grant making to making sure all the food banks were funding the food banks in our region. Houselessness became an issue. So we really went deep in helping community organizations survive and meet the most urgent needs of our community. And as you know, there's just been tons of literature on this. COVID magnified the gaps and inequities in our healthcare system. We saw cracks that they just split apart with COVID. And it was impossible to go back to our prior grant making. We really needed to think about what is our role as this corporate foundation in a world that has forever been changed by COVID-19 and the multiple complex interrelated issues that came from it. And so we, much as you did when you engaged the original focus groups and the 52 leaders in founding the foundation, we talked to our community partners. We talked to leaders in the company. We had several focus groups where we asked about, what are some priorities and community needs. We looked at a lot of data on the needs for the community coming out of COVID. And what we settled on was a 10-year vision to advance equity through whole person health in underserved communities. And with our immediate focus on behavioral health, because, there were provider shortages prior to COVID. It's just been exacerbated by COVID. And we know that people are hurting. We know that healthcare is multidimensional and interrelated with your social conditions, your behavioral health, and your access to physical care. This model of whole person health that we learned through palliative care is now being brought forward to help people who are hurting the most in our communities. And so we're focused on supporting the healthcare workforce, building up that behavioral healthcare workforce. We're focused on meeting the needs of children and their caretakers. And we're focused on older adults, what we're calling healthy and connected aging. So it's really taking this idea that we need to treat the person, not the disease, and that we need to look at people in their whole spectrum of the social factors that impact their health, the behavioral factors and mental health, and the physical health. We are all complicated, interconnected beings. We're connected to each other, and so that's where we're going. And I think amazing. COVID just showed us that this path, that we need to help the people that are hurting the most and make sure that they have access to behavioral health resources.
COVID showed us that there is no place to hide. It's there for anyone. We were all busily living our lives, and then COVID said, stop. Okay, we're bigger than anybody. We're bigger than any community, but there are some communities that just don't have the capacity, the ability. There's some people that are hurting more. And so I just think that's amazingly wonderful.
Thank you. Thank you. And of course, we remain committed to our Sojourn Scholar program and the relationships we've built and the impact of that work. That will always be part of the Cambia Health Foundation, and it's our legacy, and it's frankly what we have done for the healthcare system.
Well, you know what, Peggy, you and I have been together long enough that I'll use something I always use. May not have children, but understand clearly that the time and energy that parents and godparents and aunts and uncles put into children as they are growing and aging and learning and going to school doesn't disappear because they decide to become a rock star. It's still there, okay? They just may take a different path, but it's still there. The work of palliative care is not going to ever go away. It is forever transformed the way medicine is looked at, the way healthcare is looked at. It's also transformed the way that we as a company have looked at how we do our work and how we support our cause. And so there's no way it can go away. The Sojourn Scholars will forever be there. So it's not like stopping that and starting something else. It's like your children growing into adulthood. It's part of a journey. But the base of that journey is every bit as important as what you build after you build the base. So I just find it all very exciting and thrilling. And I'm just so proud of you guys and proud that I was able to be a small part of it.
Well, thank you. That was very well said. Paula, in recognition of your service to the foundation and the Cambia Company Board, the foundation recently established a scholarship in your honor. Tell us what that scholarship means to you.
I can't think of anything in my life that has meant more, ever. And it means a lot because, our future depends upon our ability to give back, to reach back, to support people. It's not what you get in this life, it's what you give. It's not what you take, it's what you give. And so for us to be willing to acknowledge that there are young people out there that we want to help to have hope, that we understand in the healthcare field there are gaps. We can't fix all those gaps. There's not enough money in the world to do that, but we can give some young people hope. They can be the example. And to have a scholarship in my name that says that you're going to get this bit of money, but you're also going to get something else. Somebody believes in you. Okay, there is a company and an organization that believes you can make a difference. And we're going to hold you to that. Okay, life is about giving. So we're going to give this to you and you're going to give to others. And so I can't even, and what's interesting is I wish my husband was here because every time people come over to our house, there were so many fingerprints on that thing. He comes and gets it. He walks all around the house. He's showing it to him. He's telling him how proud of me he is. And he said, this is you. This is what you do. This is what you do every day of your life. And so all I could do is say thank you. Peggy, all I could do is say thank you. And I am honored to be part of the selection committee. I'm honored that you reached back and touched my colleague, Michael Alexander, who's the reason that I sent my proposal into Regents to begin with. He's now retired and doing wonderful things in your city, but he's going to be part of that selection committee. You and I will forever be connected. And it's just, my husband and I were delighted. We will continue to put money into the scholarship fund for as long as we are able, and we will help these young people to become the best of who they are. And so that's what it means to me. And I am grateful beyond words, just grateful beyond words. So
the healthcare field needs young people who care about helping others, who want to give back. And we are so lucky that we will be able to serve on the selection committee along with colleagues at the Oregon Community Foundation and with Michael Alexander, who was my predecessor as the original chair of the Cambia Health Foundation board. And so I feel so lucky that you and Michael and I will get to work together to review applicants. I'm sure these scholarship applicants will mean the world to us as we're going through them. And I know we'll have hard choices to make, but we also know that these folks will carry forward the work in your name and will continue to make the healthcare experience better for people and families.
Yes, they can't stop us, Peggy.
Never.
They can never stop us.
Paula, thank you for everything you've done to shape the work of the Cambia Health Foundation and to influence my development as a leader. As we celebrate this 15th anniversary, I have a question for you.
Okay.
It's about the next 15 years.
Okay.
What are your hopes for the future? And where do you think this foundation can go?
Oh my goodness, what a wonderful question. First of all, I think because there's such a strong base that the Cambia Health Foundation is built on, I don't want to say the sky is the limit because that's a little too ethereal. But I think the fact that if you think about what palliative care has done, Cambia is based in 4 states. Palliative care has become the example, not just for the nation, but for the world. If Cambia does now in those 4 states, with its outreach to those most in need, to the outreach to those that are underserved, and give them tools and ways to better themselves, to become healthier, to become stronger, to become part of a healthcare system. That becomes a national example of how it can be done. And I think that in the next 15 years, Cambia will have the same kind of success in demonstrating how you challenge and address and attack some serious health inequity issues as it's had in palliative care. I think it has to be focused, it has to be measurable, it has to help those that it's helping to know that even the least of us, even those that have the least, have something to give. Nobody wants charity, okay? It's just a matter of saying, takes one to save one. It takes one candle and it's no longer any darkness. You can be that candle. It can be your voice, it can be your hands, it can be the smile, it can be the greeting, it can be going to school and helping others. But I think that's what the next 15 years are going to show, that these models that are going to happen in these 4 states with our employees, with our customers, with our providers, with the people we work with the communities, are going to become the national models for how you deal with health inequity. Yeah. That's 15 years.
I love that. I actually got chills when you were talking. You know, I think that we will become nationally known for the impact we have locally. So where our programs are lifting up the most vulnerable folks in our communities and making healthcare easier for them and making their lives better, that's what I aspire to. You know, I have been told that the foundation punches above its weight, you know, that we're not the biggest foundation, but we have great dreams and we go after them and we partner with the community to do that. And we partner with our employees. Yes. You know, one of the great things the foundation has done over the past 15 years is match 50% of our employee donations into the nonprofit community. Yes. And that match program has generated $33 million in support for our communities.
Absolutely.
And so in the next 15 years, I want to continue to build on the strengths of this foundation, engage our employees in the work, help them to connect with what we're doing, and really elevate the voices of our grant partners and our community members so that everyone living in our 4-state region has access to what they need to live their healthiest possible life. Absolutely. And that's where we're going.
Absolutely. So proud of you guys, always.
Well, thank you so much, Paula.
Thank you.
And that wraps up this episode of Health Changers. You can learn more about Cambia Health Solutions and listen to past episodes at cambiahealth.com. Health Changers is also available on your favorite podcast platforms like Apple Podcasts, Stitcher, and Spotify. Just search for Health Changers. Thanks for listening.